Our club has always been a forum for public figures, thought leaders, and decision makers to share their ideas. Here, we offer access to dynamic political, business, and public personalities.
We are dedicated to encouraging debate on the issues that matter to this city, this province, and this country.
The Canadian Club is one of the most important podiums anywhere in the world that a Canadian can speak to, tell Canadians what it is that they think, develop those thoughts. And so I want to thank you for that very, very much.
Please join me in thanking our esteemed panelists today.
Through our programs and events, including our youth and young leaders programs, our diversity partnerships, our joint events, and our media and social media opportunities, we offer you access to dynamic political, social, and business figures from abroad and right here at home.
The platform from which the eloquence of Canada has flowed all of that time, whether it be business, education, politics, sports, arts, and culture. If someone wants to say something to Canadians about this country and about the future of this country, this is the venue you choose.
Good afternoon, everyone. My name is Colleen Kennedy, and I'm the Executive Director of the Canadian Club Toronto. I will begin by acknowledging the Indigenous people of all the lands that we are on today. While we meet on a virtual platform, I'd like to take a moment to acknowledge the importance of the land, which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. We are grateful for the opportunity to join together and learn on this land. Well, as many of us start to return to the office, it will be critical for businesses to address the impacts of COVID-19 on their employees. With blurred lines between personal time and work, new working arrangements, and increased anxiety, employees will need to reimagine what an ideal working environment actually looks like. Employers will need to offer things like wellness programs, flexible work, and practical solutions to help ease employee stress around return to work. Today's panel will discuss the growing needs for these types of supports, what options are available, and the benefits to businesses that implement them quickly. Before we hear that from today's panel, I want to review a few housekeeping instructions. You'll note the click here to switch stream button, which helps if you're having internet problems. The video quality may decrease, but the audio should remain strong. And then there's the question tab. If you have any questions, it should be on the right. They will be sent straight through to the moderator, and we want to hear from you. And so we hope to get to as many questions from you as possible. And then there's a request help button. If you're having issues at all, please let us know and we'll try and help. Now I want to take a moment to thank today's sponsors, LifeWorks and Canada Life, for helping to make this event possible. Thanks to their generous support, today's event was free of charge for all of our attendees, and there are many of you who are concerned. I think close to over 700 people are joining us today. The Canadian Club is a nonprofit, and we have been gathering people together for over 125 years. It is because of our sponsors, partners, and members that we are able to do so. So thank you for your continued support. And now to introduce today's speakers. Jennifer Elia, she's the founder of Jewel Works. Christine Hildebrand is the Vice President of Health and Ability Strategy at Canada Life. And Dr. D.P. Sur is the Chief Executive Officer for the Ontario Association of Social Workers. And we are welcoming Paul Trudell today as well, the Senior Vice President of People and Culture at Ellis Don. Today's discussion will be moderated by Paula Allen, Global Leader of Research and Total Wellbeing at LifeWorks and a Director of the Canadian Club Toronto. One other tradition that our club maintains is the toast we make to our country. If you have a beverage close by, please join me in this toast. To Canada. And now I'm delighted to turn things over to our moderator, Paula. Over to you.
Great, thank you, Colleen, and thank you all for attending. This is certainly a topic that there's a great amount of interest in. We had a lot of registrations pretty much immediately after putting out the invitation, and I think for good reason. We're in uncharted waters. We've been through a couple of years of major disruption, and it's showing itself in terms of the mental health of the working population. We've been able to measure that. We know that for a fact. And the nature of work has changed as well. You know, we didn't expect to have so much disruption, but we needed to. And now how people are viewing work, you know, what's a challenge, what's not a challenge, the way things should be structured, and even perhaps the employment relationship is kind of all up for grabs. So I'm thrilled to have such a great panel with us. We have a DP with a wonderful clinical and deep clinical expertise, Christine with the insurance perspective, Paul as an employer speaking about his perspective and his actions, and Jennifer. Jennifer, I think you have basically a little bit of everything, right? But anyway, let's start with UDP. We mentioned the mental health of the working population. So 2 years we've had uncertainty, 2 years we've had risk, not completely out of it now. What are you seeing? What's happening in terms of people's mental health and well-being?
Yeah, Paula, thanks for having us here. It's such an important conversation. Things are hard right now. They're hard for everyone. They're hard for employers, employees, our teams. We're managing a lot of things: anxiety, stress, loneliness, substance use, and in our homes. And you mentioned the blurry lines in our communities. I want to emphasize that there's a significant ongoing mental health and addictions concern and crisis in Canada, and it predates the pandemic. In fact, mental health issues we know accounted for 70% of all workplace disability costs pre-pandemic, absenteeism being the leading. So we know it's costing workplaces $6 billion annually in lost productivity. And we absolutely have a role to play in stepping up. Now's the time to challenge some of the uncertainty our teams are feeling. And I think that's why we're here today, because we care.
Right. Important comments, I think, for us to realize that, you know, it's impossible to have gone through everything that we've gone through and not having it impact our mental health. But our starting point wasn't perfect either. Christine, what about you? What are you seeing from your perspective? How is this playing out in your world?
Well, I can build a little bit on what DP said, and specific to what we've been seeing. So mental health conditions have been the leading cause of disability claims for many years, increasing both as a percentage of disability claims and paid claims costs. During the pandemic, we have seen the incidence of mental health claims continue to grow. And as of the end of Q2 2022, I can say about 50% of our actively managed long-term disability claims have either a primary or secondary mental health diagnoses. One of the things that we did notice shift a little bit over the last couple of years was a shift from depression being the most common diagnosis to far more claims for anxiety. And the pandemic also created some changes, I would say, in our health claim patterns as well. More healthcare claims have been submitted for counseling services since 2020. And I know that anxiety and personal workplace stress are some of the main reasons that people are seeking support from the employee assistance program as well. So very interesting statistics from Canada Life in terms of that. Maybe, Paula, I can maybe just highlight a couple of other things that I thought were noteworthy for me. Mental Health Research Canada, in cooperation with Canada Life's Workplace Strategies for Mental Health in the Workplace, had gathered some information from, I think, over 5,000 respondents late last year. And they looked at 13 factors which impact supporting mental health in the workplace. And there were some pretty significant findings that came out of that. One being that 35% of all Canadians indicate that they're burned out, and that only 35% of employees have access to programs to prevent burnout, and that 40% of employees have help from their employer to cope with workplace stress. So real opportunity, I think, for us to get better in that space as employers, as leaders. A second survey, the Psychologically Safe Leader Survey, was done also in collaboration between Workplace Strategies for Mental Health and Mental Health Research Canada. And this was done to assess self-perception among managers on the management of workplace mental health.
Mhm.
Now, interestingly, 43% of the people leaders felt that the roles are harder now because of the pandemic. But overall, people leaders felt that they were doing a good job supporting mental health and wellness for their teams. But the report showed there were a couple of areas where employees felt that their leaders were lacking. Only 25% of employees, for example, felt that their leaders supported and encouraged work-life balance. So, interesting statistics. I mean, the pandemic has clearly had a pretty big impact on mental health. I know that as a leader right now, myself and my own organization, I'm now dealing with some of the unique challenges of bringing people back to the office. So, it's certainly going to be something that we have to focus on as we navigate back to the workplace. How do we work at the same time, take care of our mental health and support the wellness of ourselves and our employees?
Wow, amazing. I mean, I'm going to just paraphrase some of the points that you made because they were so powerful, and you cut out just a little bit. So it seems like we're seeing more mental health claims start to emerge right now. 50% of them, of the long-term disability claims, are either primary or secondary mental health. We're seeing over 1 in 3 working Canadians showing sign of burnout, and only about a third of the overall working population having access to services that can actually help them with burnout. I was seeing 43%, I think you said, of managers are feeling that their role is harder. So we're definitely going to get back to that one in terms of digging a little bit deep into it. And just generally speaking, a disconnect, it sounds like, between what employees perceive and what employers perceive is being done. Is that correct, Christine? Is it?
Yes, that is correct. There is a bit of a gap, I guess, in how employees and leaders scored themselves on their report card. To say, leaders maybe have an opportunity to focus on this and better support their needs of their employees in this space.
Yeah. Wow. Okay. Well, maybe what I'll do is I'll jump to you, Jennifer, and then Paul. Let's talk a little bit more about this leader issue. Are you surprised, Jennifer, that leaders are actually finding their job is a bit harder now?
No, it's interesting to see that data. Thanks, Christine. And I know, Paula, you said LifeWorks put out some research as well that says leaders are struggling more than ever before. In my work with organizations over the last 2 years, whether it's part of the Excellence Canada frameworks or doing some strategic planning work with these organizations, I am absolutely seeing this. And it's across all sectors, all sizes of organization, the nature of work, whether it's been a hybrid for a while now, whether it's been in office or in-person roles the whole time. There's an incredible pressure on leaders. And what I would say, we know it's a stressful time to be a leader. And when it comes to leadership excellence in psychological health and safety, there are really these calls, and certainly for the Canada Excellence Awards, where we're asking leaders to do a lot of things. We're asking them to be role models. We're asking them to be agile, to be adaptive, responsive, inclusive, and the list goes on for all the attributes that leaders need to embody while they're dealing with all of the human aspects that employees, regardless of your job function, are dealing with both at home and at work. And so just with this pace of change and the economic and business pressures on leaders, it's really, really tough right now. And I think what I would point to, I've seen some leaders really thrive. Even some who've been struggling are moving towards more of a thriving a state of being with how they're showing up as leaders. And the ones who are doing that well are really creating a distinction, focusing on 2 key areas that are, one, maybe simplified, not easy, but simplified, and 2, within their own locus of control. And the first thing is simply hold space. So given that we don't have a roadmap for how to navigate the future of work, that many minds and many different organizations, and this is around the world beyond Canada, need to be working together to chart that course for the future. Problem solving, which leaders tend to sort of orient to, it's too much to take on. So what you can do, though, is hold space, set the tone for honest, real, candid conversations about employees' experiences. And that allows for a dialogue around what's working and what's not working. This can be done at both the macro level, thinking about town halls or online forums, or at the micro level within teams and in one-on-ones. And then the second piece, and this has benefits for the organization as well as for the leader personally, is to model self-care. It's so important, and again, not easy because it requires a certain amount of vulnerability, but to model self-care and be seen as doing so in a very high profile, visible way is something that takes a lot of practice, but then when it can be done well, it can create a caring, empathetic, and supportive culture. And that's what we need, just back to DP's point, when we're showing that we're moving towards an organization that will have the structures and the culture to be able to succeed going forward.
Oh, brilliant. And I love how you simplified something that feels so overwhelming and complicated in terms of holding space and modeling self-care, which, by the way, isn't just for the sake of modeling. It's that people do need to take care of themselves. And you mentioned the research that LifeWorks has done, so I'll just add a little points and hopefully it helps the conversation. We actually found something fairly astounding. Prior to the 2020 start of the pandemic, typically leaders scored a little bit better in terms of their mental health scores. You know, being a little older, with problem-solving skills acquired through leadership, a few more resources. But that changed. It flipped during the pandemic. And we saw the weight of not only dealing with everything that everyone else is dealing with, the change and uncertainty, but also the need to make sure that there were answers or the feeling that there needs to be answers when there were no answers, managing the business, managing customers, making sure employees were supported. And in fact, 4 out of 5 said that they had dealt with a mental health issue of an employee, and most didn't know what to do. So your advice, Jennifer, in terms of holding safe space and modeling self-care, I think is quite helpful. And Paul, maybe we can hear a little bit from you. So maybe
Sure.
talk about the nature of your business and the different aspects of it, and some of the things that you found to be the most challenging and some of the things that you found to work the best through this last period of time.
Well, that's wonderful. Thanks so much. Just to build on Jennifer there, I think some of the points she brought up was, maybe starting on the larger level, but even in the smaller ones, in the construction industry, a male-dominated machismo sort of environment that we find ourselves in, this topic probably is one that most people would perceive to say it may not get the shine or it may not get the light that it deserves. But it certainly has been front and center. Everything from toolbox talks, which would be group sessions on an individual site where they're building a building or a bridge or whatever it may be, just as a health and safety precaution, just to talk about the importance of wellness and the importance of self-care. We'd make sure that we'd find opportunities like that, to larger discussions where our CEO, Jeff Smith, it's front and center. We're trying the best we possibly can to ensure that everyone at Ellis Don feels comfortable to talk about their mental health, that it's something that, as much as we understand it's a difficult topic to review, we have to normalize it as much as we possibly can so that we can see those signs. Some of the things that have worked really great for us is the Mental Health Commission of Canada has put out mental health first aid training, and we've mandated it across our organization. We're 9 sessions into it now. A 9-hour training program that would really involve just even seeing the signs and figuring out what's working versus what's not, and giving people tools to really understand how they can protect their mental health has been really important for us. And it's gone through with resounding results. Our employees are coming into the workplace
with the right skills to be able to identify when people are having challenges and how to address the conversation, and moving them along to the professional experts on the panels with me to help us even further so that we can figure out how to help them. That's where it all comes from. But they've also been bringing it home. Wonderful conversations from families saying, you know, my husband's more attentive, or my wife is coming home and they're understanding that they need to talk through some of the daily challenges that they're experiencing. So from our organization as an employer, normalizing that conversation and really just trying to do our best to make sure that people have the tools has really worked well.
Oh, it's brilliant, Paul. I mean, it sounds like you're paying attention to making sure that people feel that there is a culture of openness, a culture of safety, a culture of well-being in the organization. Would that be fair to say?
Absolutely. I think at every level, we need to make sure that our employees feel a certain way, but just the amount of times that people have been checking in with leaders, whether it be an employee to a leader or a senior executive with a leader, or an employee to a senior executive to say, we see you've got a lot on your plate. Is there anything we can do to help? So it's been great.
All right, leaders are people too, yes.
That's right.
That's a good thing to remember. And maybe over to you, Christine. Is there anything that you've been seeing or that you would recommend that employers really focus on during this time? I mean, I think we all sort of realize how important it is to focus on mental health and well-being and the connection to workplace productivity and good culture. But right now, it's pretty acute. So, any words that you would want to share with the audience?
Oh, I could share many words, and I could talk for hours on end. So, you know, I'm very passionate about psychologically safe and healthy workplaces. So, it wouldn't be a presentation if I didn't, you know, suggest that employers really look at implementing the national standard on psychological health and safety in the workplace. We do know that in organizations where they have implemented the standard, fewer employees feel that their workplace is psychologically unhealthy. That's a good thing. And we know that in organizations where you have adopted the standard, employees who have or are experiencing depression, for example, miss less time away from work. So that's good. As an insurer, I would encourage, you know, all employers to actually have a look at their plan design, ensure that their healthcare plan has coverages and maximums that are sufficient. So I know across Canada, the typical coverage for counseling is well below what is required to efficiently and effectively support and treat someone. So those are a couple of things that I would suggest. I'm a leader, and I work with a large number of leaders at Canada Life. And one of the things that I do promote for our leaders is that they leverage the psychologically safe leader assessment that is available on the Workplace Strategies for Mental Health website. It's a free resource. And it helps leaders become aware of the impact that they can have on psychological health and safety of their employees at work. So it's a really good resource to have leaders focus on, as well as other resources there like emotional intelligence assessments, things like that. If I think about specifically about returning to the office, I did a presentation with my own leadership team last week and spent about 2 hours talking about strategies that we can put into place. But you know, one of the things that I think is important, and it's been highlighted here, is demonstrating empathy as we go through this. Demonstrating empathy to one another, I think, is key. Listening with an open heart and an open mind. We have a range of emotions that people are processing about coming back to the office. Some have health concerns themselves or health concerns of family members. Some have childcare issues. So I think listening, alleviating concerns wherever possible, and being flexible in terms of the workspace, the time in the office, the time at home. If you can offer flexible work options, I really, really think that that's a plus. And as was mentioned, I think really encouraging and allowing people to process their emotions, because during times of change and times of stress, that's very, very important to your health and well-being. Keeping things bottled up or ruminating about them can negatively impact our health. So I support, you know, that, and reframing negative thoughts. That's something I spend time doing myself. It's a practice that I do. You know, if I have a negative thought, I try and reframe it to the positive.
Wow, wonderful, Christine. A lot of good thoughts. So just going to summarize again. the focus on the psychologically healthy and safe workplace, and looking to Canada's national standard as a guide. And by the way, the world is looking to that. It's been influencing ISO standards and other standards all over the world. So we're not just looking at the individual, but we're looking at the workplace as well. Looking at your plan design and making sure that there's no undue barriers for people, have the tool or that manager self-assessment on being a psychologically safe manager. Empathy and gratitude, two big concepts. And I think people really resonate with the empathy because it has been difficult. And reframing some of your thoughts to be grateful for what you have, as well as showing gratitude to others. DP, you could probably speak about the people value of that as well.
Yeah, I wholeheartedly agree with what's been said already. When I consult with leaders across Ontario, I often talk about how it's time now to transform the culture and to track that change. We can absolutely innovate with empathy. We've heard emotional intelligence is key in leadership skills. Well, now empathy is just as important. Think about workplaces now. Mental health is becoming the tapestry of all workplace environments. And the social network we work in is tremendously important. And it's time now to take care of that. And in our employees, I talk about three really important things. Communication is key. Paul, Jennifer, and Christine, you've talked about that from the leader level through to our frontline, our students, folks that walk through the workplace. They need to feel that. And the trust and that flexibility matter. And that's a big part of empathy. But you also talked about taking care of your people. It's so crucial to think about their mental health benefits. A lot of folks don't even know that social workers are part of the very fabric of our society. Over 20,000 of us in Ontario, ready and willing to wait along with other mental health professionals for support and provision of care. And so doubling up and thinking about your mental health benefits and what you're providing to your colleagues and your teams and your leaders is so important. We recently put out a press release about Canadian business leaders needing to step up. 1,500 per year is what we're actually calling on. So you can have consistent coverage and you can talk about it frequently. And that you can invest in your most important asset, your people, because you'll benefit.
Well, that's important to understand for sure. And there's actually an interesting comment that came up as part of the Q&A, where somebody was commenting on just observing behavior. This is behavior that comes across when you're dealing with the public, somebody who's dealing with the public, whether it's in a retail environment or service environment, but also, quite possibly in workplaces environment, and that's the edge. So a little bit more anger, a little bit more cynicism, a little bit more sensitivity to stress. Maybe Deepa, just sticking with you, and then maybe Jennifer.
Yeah. Well, it's hard for people. Think about folks that have been at home. I think about my team. They've been in my house. They've watched my dogs answer the door to the Amazon deliveries. They've watched my children come home. They've seen difficult moments of me turning my camera on and off as I navigate. And so are my colleagues across the world. We're dealing with caregiver distress. You've been taking care of loved ones. You've been managing how to do Zoom through, technical challenges. You're on mute is our favorite comment of the year, right? And you're trying to find ways to insert yourself in meaningful conversations and be a good employee, a good parent, a contributor, a loved one, a family member. Those are not easy things. And so if we can model some of that and we can give space, some trust and honesty to those difficult conversations, we're going to see tons of folks open up with vulnerability and authenticity. And leading with that is an important value. And building that in right now is crucial. And so I agree with you. It is a difficult time. And I would challenge people to think about, replacing words like cynicism with, how difficult it must be to manage and blur those lines and let people back into new hybrid worlds. So many of us today have talked about the importance of building that flexibility into the workday. I think that building that trust and that communication into your team conversations will, you'll benefit fruits of your labor.
Right.
Yeah, I'll build on that, Paula. I think, what DP you're saying is validating someone's feelings, their experience, their emotion. And it's really compelling when we can use the power of storytelling to create connections. And the reality is, and this is, I think, what we're seeing, that there's a plus and a downside to it. Collectively, we don't need always more workplace well-being programs. We need a better understanding and appreciation for what those programs are, and a knowledge and efficacy among employees on how to use them and when to use them. So if we can lean on the power of storytelling, that when someone does tap into those resources available, that they're sharing that with their leader, they're sharing that with their team, sharing it on any kind of social forums that an organization might have, it will encourage others to take those steps forward. So an example of how that works really well and is really important right now is, we know the mental health care system is incredibly challenged with capacity. And there are often many steps between someone first getting to, yes, I need support and I'm wanting to take a step forward, and then actually being able to access that care. And then realistically, when it comes to therapy, it might take a couple tries to get that therapist that is the right fit for you. So when we can be bringing into the workplace and more broadly into communities that power of storytelling, the benefits of that are going to be really, really important in the years ahead. And I'm hearkening to an organization I'm part of this year. I've got the deep honor of serving as executive director for a charity called Unsinkable. And this is what we do. We create online spaces for people to hear stories across the entire health continuum from people who are similar to them. And the idea is to create hope, to create that sense of empowerment to be able to take a step forward. So I think when we can see more of that, and Paul, when we were doing our prep call, you touched on this as well, that at Ellis Don, you're having some more sharing, more vulnerability among your leaders.
Yeah, Jennifer, it's such a great point. More isn't always better. There's a constant call coming in of organizations that want to new and give us something that we can have help our employees. But it really comes down to, how well are you communicating the existing programs you have in place? LifeWorks is there for us. Why aren't we using it? Well, we know that 33% of our employees are going on our employee portal on a regular basis. But what about the other 67% of the people? What are they doing? So how are we getting that information out there? And some of the things that we're doing and sharing is really just putting it out there and asking employees for stories and what did you see and how can you help us and what other information is out there. And we've got a lineup of employees who are putting their hands up to say, I want to be part of the solution. And here's my story in a very public way to say, here are some of the things that I'm dealing with. And it's really at the leader level and through to employees, right through to an employee who is going through a pretty traumatic time in their life. And they decided to share it through storytelling of a video at the most public forum in our organization, which is our annual general meeting. And it was a 4-minute video about all of his struggles and the amount of thoughtfulness and reaching out to this individual to say, thank you for sharing your story. You've given me the opportunity to have the courage to start talking more as to my organization, to my family, and really look for the help that I need. Has just been wonderful. So, don't always look for more, but look at encouraging your employees as much as you possibly can to put their best foot forward and get the help that they need.
And that's a wonderful reflection. Like, think of a culture, think of an organization where you can feel safe being yourself, that you can feel supported, that there's inspirational stories of people move forward. I mean, that's a place and a time and a culture that you remember, and I know from a fact has positive impact on people. Yeah.
Definitely.
And from an HR perspective, it's a tool as well when we think about the so-called Great Resignation. And lately I've been hearing the term the Great Resistance as we move towards different work models. We're always looking for new ways. And I think we're getting some answers that a caring culture, empathetic culture, supporting culture, a safe culture are the ways to create that loyalty among our people in our organizations.
And it looks a bit different, right, Jennifer, for each group. I think, if you think about some groups, it's harder for our racialized populations to come back to work in the current context. And given what has happened in the last couple of years, it's truly difficult to create environments that are spaces and that are safe for each person. So thinking about how you look at those conversations and build capacity to have conversations about anti-racism and discrimination and what it takes for particular groups to participate in difficult conversations about mental health and the impacts for each community. And so I think that really does start with a genuine, authentic space and openness.
It's interesting as well that over this past, we've gotten wiser, I think. Sometimes you go through a crisis and then everything just becomes a lot clearer. So even the point that you made, Christine, around the intersection between employee mental health and well-being and diversity, equity, and inclusion and belonging is becoming a lot clearer. I see that in many different places. It's really just having a workplace that's open, respectful, equitable, and where people can be themselves and feel valued. We've got some great questions, though, for our audience, so I just want to make sure that I give some voice to that as well. With everything that we're talking about, a lot of the points in people's minds are relating to how it plays into moving into this next phase of work. And for many organizations, it's hybrid work. So maybe, Jennifer, if you could start off, there is a concern that hybrid work might develop unintentional consequences. So perhaps, cliques, those who are in the office, those who are not in the office, random or multiple cultures as opposed to one. How would you advise an employer to encourage the best?
Yeah. Well, and what I would say is that comes down to being very intentional for each organization to develop a model that the hope is will work for them, and then continue to gather feedback, real-time feedback from employees about, is this model working? And this happening. I don't go a day or even an hour without seeing some kind of update around what somebody is doing with their model for hybrid work, for those that do have a strong in-office component. And sometimes it's a blend of field work and office, depending on the organization. To me, this is, I think, an exciting opportunity to really challenge old paradigms about where work is performed and being very purpose-driven. And by that, I mean, what is the purpose of the work? What is the purpose of the meeting, of the session, of the one-on-one? And with those objectives in mind, then you can plan the space that is best suited for that work to happen. So I'm already hearing stories of people commuting into downtown, whether it's Vancouver, Montreal, Toronto, Calgary, just so they can sit in an office and be on calls all day. That to me is not a purpose-driven, intentional decision around where to perform the work. And it's not going to create that opportunity for creativity and engagement and work-life integration. But rather, a great time to be in the office is for planning, is for one-on-ones, is for team building, collaboration. When it just so happens that there's a region where people are in the same geography, which isn't always the case. So I think the models that will be sustainable and sustainable in terms of business performance, as well as the loyalty and longevity of your highest performing people, are the ones that are very intentional and flexible around where work is done and why.
Right. And you can build a culture of respect and collaboration and flexibility, whether people are in the office or not. But I'm also hearing very clearly that when people are together, make sure that those moments matter. Make sure that they are the moments that'll help build people's sense of belonging and make sense. Is that correct, Jennifer?
Totally agree. Yeah.
I really agree with Jennifer on that. It has to be purposeful reasons why you're going to be in the office and looking for those opportunities for connections and collaborations. Now, one of I think the unique challenges that this is bringing forward, though, is when you have people in a remote setting and you have people in the office, how do you keep everyone on an even playing field, right? And that you don't, as a leader, become biased to connect only with the people who you see in the office? And how do you keep the connections happening that we worked very hard to build during this pandemic with some people at home and some people in the office? It really is going to take thoughtful and intentional leadership, as Jennifer pointed out, to be mindful of that, make sure that everyone remains connected. I have a team that is distributed across Canada. We have a lot of people in the same location, but we have people across Canada. The people outside of Canada or outside of Winnipeg have never felt more included in the past 2 years compared to pre-pandemic. And we don't want to go back to where they were feeling 2+ years ago. So my leadership team needs to think, how are you going to intentionally keep the connections between people in an office, in a meeting room, and people outside working from home?
Okay. Wonderful. Thank you so much, Christine. I'll move forward to another question, but before that, I'd love to hear your thoughts on this whole new way of working, Paul.
Well, it's really tough. Like, as the person who's trying to protect our culture as much as I possibly can, along with all of our other leaders, while I agree with what everyone is saying, the reality is it's so challenging to put that into practice. And we're going to make mistakes along the way. And as an organization where most of our work is done, getting onto a job site and everything is done in that way, I'd probably say 60% of our employees need to be in there. The other 40%, yeah, we're slowly transitioning back. We're trying to be thoughtful. We believe for our culture, we want people in the workplace, but we're not going to just mandate it and say, on November 1st, everyone's back to work 5 days a week and thou shalt, and there it is, and that's it. So we're doing the best we can to listen. We're trying to put great practices in place. It's challenging. Every single day is challenging because everyone's got different needs. So we're doing the best we can to listen, and we'll continue to do that as we go.
Okay. And over to you, DP. I mean, this whole transition, if we remember the beginning of this conversation, has this backdrop of more vulnerability in the population than we'd seen before. So a couple of questions have come up around, concern about isolation, employees being more isolating, and also how a manager does model self-care. So any comments on those points?
Yeah, for sure. I mean, flexibility doesn't mean adaptation to hybrid working environments is not important, right? And it doesn't mean that we can't be thoughtful about how to extend that trust to accommodate changes and especially in the routine that people are used to. People have found new ways to build in and boost happiness into their day. We used to go for a coffee break. We used to go for a lunch break with our colleagues. That's not so possible. So people were taking walks. They were spending time folding their laundry quickly in between Zoom calls, getting a meal made for their families so they could spend an evening together. Find out what matters and what values your employees bring and what absence they're going to feel when they enter back into that workplace. And I also talk to leaders a lot about embracing disconnection for your teams. So a lot about that work-life balance or harmony. This means downtime after the workday and prioritizing mental health and family during those moments of disconnection. Being virtual doesn't mean we're online all the time. And Jennifer, you talked a lot about making collaboration matter. We talk about this in our team setting. When you come in, you should be planning, thinking about how to engage with your team, thinking about how to model a healthy workplace and those habits, and how to build an environment that includes the rest of the team at home as well.
Right. And I love that point that you made around building in positive moments, building in moments that make you happy. I think sometimes we've forgotten how important that is. And if your regular routine is not your regular routine anymore, you might be missing that. Your world might be unintentionally a little bit smaller unless you take some action. So
yeah.
Points. Okay. So a couple of things. Christine, when you spoke before, I think a few people missed the name of the website that you were recommending for those resources. And the other point is just that recommendation around, how much do insurers typically provide for mental health support, and how much is going to likely be the way people go in the future. So starting with the website.
Okay, well, I'm happy to answer that question. The website is the Workplace Strategies for Mental Health in the website. So it's got a fabulous number of free resources that can support organizations, can support leaders, and can support employees. I encourage everyone to go spend some time in there. I think you'll find some valuable resources that will help you promote psychological health and safety in the workplace. The second question was with respect to the coverage amounts available under the healthcare plan. So we see a lot of employers providing around $500 coverage. But as DP would say, I'm sure, that really won't cover a lot of sessions with a social worker or a psychologist. So we have seen some employers increase their coverages to $5,000 or higher. But I would really encourage people to consider $1,500. I think, DP, that's the call out that you just mentioned as well. That would be a great step in the right direction.
Yeah, that's great, Christine. Great to see that. You're right. We've definitely seen extreme boosts across the province and across Canada as well. And those that are increasing their benefits, they're showing their employees that they care about them and they care about themselves and their mental health. And they're showing them that access matters, and continuous concerns that need to be addressed through mental health conversations can happen both in the workplace, and then when you need the extra support, you have that through your health benefits plan. So great to hear.
Great. Well, certainly we're having a great opportunity to really pay attention. The focus on mental health is increased. The focus on workplace culture has increased. The need for connection and collaboration, no matter where you happen to be, that the value of that has certainly increased. But we're continuing to learn. And I was intrigued by a comment that you made a little bit earlier, Jennifer, not just the great resignation, but the great resistance. Can you speak about what you mean by the great resistance?
Yeah, and I think this goes to what Paul was saying as well, that this is not easy when we have such a diverse economy and businesses in Canada to come up with a best practice going to work for all organizations. And so the resistance is what we've been hearing when employees are kind of forced into something that is more structured than what they've been used to over the last couple of years, and may not be feeling good about that for a variety of reasons. It will vary by the person. And so it just drives home the point that we've been talking about flexibility, yes. Also with that listening acumen of always prioritizing, checking in with employees about how things are going, and being committed to, certainly as leaders, to making adjustments that are going to create that balance between the organization's needs and the employees' personal and work-related needs as well. So what we're all going towards is the highest possible performance and sense of thriving. And it's going to be an interesting road ahead.
Great. Well, certainly we've heard a lot in what I believe is two big buckets. You know, as we're going through this time, employers really can be helpful, and focusing on the support that's needed, making sure that there are those empathetic conversations, as you spoke about, Paul, and that there is a highlighting of resources that are available. Christine and DP spoke about making sure that benefits are at a level that actually can cover the services. And there've been some questions around the type of professionals that are covered. And I believe you both said, psychologists, but also social workers are typically covered under an insurer's health benefit plan, correct? Yeah.
Yeah, often there's coverage for various mental health professionals, and social workers, registered social workers are a big part of that. Absolutely, psychologists alongside other mental health professionals. Sometimes you'll see psychotherapists covered, of which mental health professionals like social workers can provide that care. So there are a number of folks that are part of a mental health continuum that can absolutely address concerns. And employers that are investing the time in getting to know their health benefits plans will look into that to see what kinds of coverage there is for mental health and addictions right across the board.
Which is a great point. I mean, and there's the continuum of services too, because employee assistance programs have social workers as well as other specialized professionals. We can't forget about the need with respect to addictions. So a whole bucket around the support that's offered through a workplace, but then a really robust discussion around the workplace itself. Showing empathy, making sure that we're jointly problem solving. Flexibility, all these things sound to me like things that are going to strengthen workplace cultures moving forward. It's not just skills and attitudes that'll be important for a particular point in time. So once again, thank you all. I don't think we could have put together a better panel in terms of the perspectives that you have. But I'll ask each of you maybe just to speak, very briefly about what you would like the audience to leave with. So your big takeaway from today's conversation and all the things that have led up to it. So maybe starting with Jennifer, then Paul, Christine, and Deep.
Thank you, Paula. I've learned so much, and I want to leave our listenership with a positive note and some encouragement to take stock of what we've been working at. If there are 700 organizations here, many of you will be global organizations. Many of you will be smaller organizations. We've got decades of experience and foundational models about what works for workplace well-being. We understand the health continuum. We understand mental, physical, financial, spiritual health integration, how important that is. We understand the need for wellness champions, wellness councils. Keep all of that. Those are the things that we need to continue investing in. It's time, though, now in 2022 to layer on a few very important things, and this relates to what we've been talking about. First is leaders as champions of well-being. So champions historically have been across all levels of the organization. We're bringing that up, and I think we have a role for those of us working in this space to develop leaders to be able to do that well. So leaders as champions. We want to see integration point of a different sort beyond health dimensions. We want to see integration across your benefits programs, your well-being programs, and thirdly, health and safety, especially with hybrid models and changing face of work and where work is performed. We want to see those integration points. So I think layering on those couple of concepts to what we already have as a strong foundation. We have the programs, we have the measures, and we have the support among each other in terms of best practices for how to lead this whole practice area for the future of work.
Beautiful. Certainly a new view of well-being and well-being programs moving into 2022 and beyond. Yeah. And Paul, your thoughts? What would you like to leave people with?
Thanks very much. So from my perspective, it's really hard as an employer. Like, we're going through a lot right now. And I think that if we can just sit back and breathe and relax and just understand that everyone is going through this, for me, is key and important. But there's a really great group of people that already work for you that want to be part of the solution, and they're your employees. Reach out to them, talk to them, get their perspectives. From my perspective, we've really benefited by our employees putting their hands up and sharing their real life story and having that courage to make a difference. And I think if you talk to your employees, they want to be part of the solution. So you should get in touch with them. Thank you.
I think we sometimes forget that employees want a successful workplace. They want to be part of the solution and the problem solving. They want the best for the company as well as themselves. So wise words, Paul. Yeah.
Thank you.
Christine.
Well, I think I'll just build on what was said. I think what really is key is that you can't have a successful workplace or a psychologically healthy workplace without employees and leaders. So to Paul's point, and one I really appreciate him bringing forward, is engage your employees and your leaders and work towards the future. And I think the other thing I would just say is you don't need to have additional budget. You don't need to have money. You don't need to bring in new programs. You can leverage what already exists and make a meaningful difference moving forward. And everyone here can do it.
Right. And again, your point around the psychologically safe workplace kind of wraps around the world twice. I don't think anybody has the extra energy that it takes to be in a workplace that's not unsafe. And we know that it impacts not only mental health, but everything, productivity, innovation. So focusing on that, a big win-win.
Mm-hmm.
And DP, last but not least.
Oh, such great points today. You know, I hope everyone tuning in has had a chance to digest a few practical tips and how we can all step up to address mental health and addictions together in the workplace. And absolutely, we can innovate with empathy. But I, want to say start by building honest and frequent communication. Offer mental health training to folks who step up and want to learn about mental health first aid or the likes of. Think about your workplace benefits and then talk about them at all levels, at team meetings, at town halls, in your e-bulletins, everywhere. Build trust and flexibility, and most importantly, now's the time to capitalize on conversations that lead with empathy, because it really does begin with showing that vulnerability. We can do this together for sure.
Great. Thank you so much. Wise words. And also reminding us that most of us didn't come into this world or at any point growing up learn specifically about mental health or how to be mentally safe leaders or anything of that sort. But with the importance with everything, quality of life, work productivity, everything, it does make sense to invest in that training and knowledge. So again, can't thank you enough on behalf of the audience, on behalf of the Canadian Club for your passion and your insight and your wisdom and sharing your time. And I'd encourage everyone in the audience to also consider, if you're not already, to be a member of the Canadian Club. We strive to make sure that there are events like this, as well as in-person events, on things that matter, the things that make a difference, and to push your mind and to push your thoughts and to hear from you in terms of the things that are important and share that knowledge. We'll also have a video of this particular session available on our website this afternoon. So if there's any part that you missed or something that you would like to share with someone else, it's available for you. So back over to you, Colleen. And again, thank you to everybody for attending.
Thank you, Paula, and thank you for that wonderful wrap up and your expert guidance of today's discussion. And Jennifer, Christine, Dr. Sir, and Paul, thank you for taking the time to join us today for this incredibly important conversation. Lots of questions were coming in. Tons of people want to watch this recording and get it out to their employees. So I think will be a great resource for months to come. So helping everyone to be their best. And we appreciate you taking the time to join us today. Thank you again to our sponsors, LifeWorks and Canada Life. We appreciate your generous support of today's discussion. And of course, sponsor and partner, VVC, Van Valkenburg Communications and livemeetings.ca. I would hope that you maybe would join us for a few more events coming up. Tomorrow, we have Al Monaco, the CEO of Enbridge, and there's still time to join us virtually for that event. On May 26th, we will host a panel, Industry 4.0, how you need to be more than just digital, featuring senior leaders from Rogers, Purelator, and the Ontario Centre for Innovation. And on June 1st, we host an in-person event that we're thrilled to have the national Inuit leader, Natan Obed, where he'll discuss the federal Inuit Nunavut policy and building a Canada where all Inuit can thrive. So to learn more about our upcoming events, explore our website at canadianclub.org, become a member, as Paula said, and thank you for your support. So with that, I say goodbye, and I would like to wish you all to stay healthy and safe, and we'll see you soon.